Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Zulhazri bin Zakaria with metric number AE190019.
My name is Arifah Khalisha Binti Khalid. My metric number is AE190057.
My name is Dania binti Azaman with metric number AE190066.
Hi, my name is Siti Nurlina Binti Azmi. My matrix number is AE190030.
I am Nurul Ruzana Binti Abdullah, AE190050. Assalamualaikum warahmatullahi wabarakatuh. I am Nurul Ruzana. I will present the introduction of MRI scanning. MRI scanner was invented by an American physician of Amerindian named Raymond Van Demedian. He was one of the first people who noticed differential NMR relaxation between normal and pathological tissue. He proposed NMR, which means nuclear magnetic resonance relaxation body scanner, on 1969 and performed a full body scan of human being in 1977 to diagnose cancer. Magnetic resonance imaging (MRI) is a non-invasive imaging technology that produces three-dimensional, detailed anatomical images. It is often used for disease detection, diagnosis, and treatment monitoring. It is based on sophisticated technology that excites and detects the change in the direction of the rotational axis of protons found in water that makes up living tissue. To obtain an MRI image, a patient is placed inside a large magnet and must remain very still during the imaging process in order to not blur the image. Constant agents, often containing the element of gadolinium, may be given to a patient intravenously before or during the MRI to increase the speed at which protons realign with the magnetic fields. The faster the protons realign, the brighter the image. Next, I will tell you the use of MRI scan. Firstly, MRI scanners are particularly well suited to image the non-bony parts of soft tissue of the body. They differ from computed tomography, which is CT, in that they do not use the damaging ionizing radiation of X-rays. In the brain, MRI can differentiate between white matter and gray matter and can also be used to diagnose aneurysms and tumors. MRIs are very useful for examining the brain and spine cord. Lastly, one kind of specialized MRI is functional magnetic resonance imaging (fMRI). Is used to observe brain structures and determine which areas of the brain is active, which means consume more oxygen during various of cognitive tasks. It is used to advance the understanding of brain organizations and offers a potential new standards for assessing neurological status and neurosurgical risks.
Assalamualaikum warahmatullahi wabarakatuh. I will present about the working principle of MRI scanner. Okay, the basic of MRI. First, the directional magnetic field or moment associated with charged particles in motion. Second, nuclei containing an odd number of protons or neutrons have a characteristic motion of precision. Lastly, because of the nuclei are charged particles, this precision produces a small magnetic moment. Alright, let's go about the how MRI works. MRI is employ powerful magnetic, which produce a strong magnetic field that force protons in the body align with that field. When radio frequency current is pulsed through the patient, The protons are stimulated and spin out of the equilibrium, straining against the pole of the magnetic field. When radio frequency field is turned off, the MRI sensors are able to detect the energy release as the proton realign with the magnetic field. And to obtain an MRI image, a patient is placed inside a large magnet and must remain very still during the imaging process in order not to blur the image. Contrast agents, or often containing the element gadolinium, may be given to a patient intravenously before or during the MRI to increase the speed at which protons realign with the magnetic field. That's all from me.
MRI is a medical imaging device commonly used to examine the soft tissues of the human body. Let's meet the machine. The key components are the magnet, radio waves, gradient, and a computer. Our bodies are made up of 60% water, and water is magnetic. Each of the billions of water molecules inside us consists of an oxygen atom bonded to two hydrogen atoms. We know it as H2O. Small parts of the hydrogen atoms act as tiny magnets and are very sensitive to magnetic fields. MRI stands for magnetic resonance imaging, and an MRI scanner is one of the main diagnostic tools that doctors use to examine inside our bodies. The first step in taking an MRI scan is to use a big magnet to produce a unified magnetic field around the patient. The gradient adjusts the magnetic field into smaller sections of different magnetic strengths to isolate specific body parts, for example, the brain. Normally, the water molecules inside us are arranged randomly, but when we lie inside the magnetic field, most of our water molecules move at the same rhythm or frequency as the magnetic field. The ones that don't move along the magnetic field are called low-energy water molecules. To create an image of a body part, for example the brain, the machine focuses on the low-energy water molecules. Radio waves move at the same rhythm or frequency as the magnetic fields in an MRI machine. By sending radio waves that match or resonate with the magnetic field, the low-energy water molecules absorb the energy they need to move alongside the magnetic field. When the machine stops emitting radio waves, the water molecules that had just moved along the magnetic field release the energy they had absorbed and go back to their position. This movement is detected by the MRI machine, and the signal is sent to a powerful computer, which uses imaging software to translate the information into an image of the body. By taking images of the body in each section of the magnetic field, the machine produces a final three-dimensional image of the organ, which doctors can analyze to make a diagnosis.
Methodology. What is MRI scanner?
Medical imaging technique used in radiology to form pictures of the anatomy and physiological processes of the body.
Technique of MRI. Reasons to use MRI.
One, during the scan, magnets in the machine will create a strong magnetic field. 2, then the scanner will send radio waves through your body. 3, when the radio waves are turned off, the scanner will pick up energy signals from your body. These signals are used to make the pictures.
So now, I will explain about the conclusion of our project. which is MRI scanner. MRI provides many functions in the medical system. It also can determine the effects of tumors, stroke, head injuries, and Alzheimer's. The side effect of MRI can cause nausea, headache, and pain at the point of injection. That's all from me. Thank you.
Hey.
In the field of healthcare, there have been major advancements in medical imaging techniques. Their ability to create visual representations of internal structures and organs of the body allow these imaging techniques to have major clinical applications. Today, we discuss three of the most commonly used imaging techniques: the MRI, CT scan, and the PET scan. This is Michael. Michael suffered a knee injury while playing basketball last week. After an appointment with his doctor, Michael finds out he'll be needing an MRI scan to determine if he needs surgery. Well, what exactly is an MRI? An MRI, which stands for Magnetic Resonance Imaging, is a technique used to generate an image of one's body non-invasively. When undergoing an MRI scan, a patient lies on a movable bed which is surrounded by the MRI scanner and a circular magnet. Radio waves 10,000 to 30,000 times stronger than the magnetic field of Earth are sent through the body. As we all know, our bodies are mainly composed of water, which contain hydrogen atoms. These waves cause the nuclei of the atoms to change position. As the nuclei move back into their original positions, they emit their own radio waves, which the scanner picks up and ultimately turns into a picture that is seen on a computer. For the most part, this procedure is painless and risk-free. It should be noted that pregnant women or anyone with a pacemaker or any sort of metal implant cannot do an MRI scan due to its powerful magnetic force. After finishing his MRI scan, Michael meets Sarah, who just underwent a CT scan for her severe abdominal pain. A computerized tomography scan produces detailed images of the body mainly through the use of X-rays. Several beams of X-rays, all from different angles, are sent through the body during a CT scan. Each angle provides a picture of a thin slice of the area being analyzed. The data is saved on a computer, which takes these two-dimensional pictures and creates a 3D cross-sectional picture of the area. In some CT scans, a dye called contrast material is taken by the patient through injection, solution, or inserted rectally. This dye makes structures and organs easier to see on the pictures. Because of the extreme accuracy and detail of these pictures, CT scans are used for a myriad of the body's internal situations, including internal injuries from trauma, muscle and bone disorders, detecting lung and liver diseases, and also detecting different types of cancer. CT scans provide advantages in comparison to an MRI scan, as they provide higher resolution pictures. However, they do pose some risks as well. The ionizing radiation from the X-rays has been linked to increased risk of cancer, although it is a low possibility. The most common risk of CT scans is a reaction to the contrast material, which is generally mild and results in hives or itchiness. Similar to MRIs, pregnant women should not undergo CT scans in order to avoid radiation exposure to the fetus. Finally, meet Claire. Claire has a history of coronary artery disease, so her doctor advises her to undergo a PET scan. A positron emission tomography scan is performed by using a special dye that has radioactive tracers. The patient injects this tracer and it is subsequently absorbed by organs and tissues in the body. The PET scanner can highlight these tracers and see how well organs and tissues are performing. PET scans can therefore measure blood flow, oxygen use, and glucose metabolism. A major difference between PET scans and the two previous scans is the ability of a PET scan to show problems and complications at a cellular level. The resolution might not be as clear as an MRI or CT scan, however it gathers more functional information. To prepare for a PET scan, the patient must notify their doctor about any medical conditions and if they are pregnant. In some instances, it is advised that the patient does not eat for 8 hours prior to the scan. Risks associated with a PET scan are similar to those of a CT scan, including exposure to radiation and allergic reactions to the injected tracer.
The MRI, CT scan, and PET scan are three of the most commonly used techniques for medical imaging. We learned the benefits associated with each, such as the high resolution provided by the CT scan, or the functional information given by the PET scan. Furthermore, we also learned about the disadvantages and risks associated with these scans, such as the possibility of an allergic reaction to the tracers in a PET scan, or the exposure to high radiation in CT scans.
In conclusion, the benefits outweigh the risks in all three of these scans, as they provide essential information for patients and healthcare providers in need of help.